Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Alisa Curry. Dr. Curry is a board-certified geriatric clinical specialist in physical therapy and coordinator of rehab clinical programs at Washington Hospital Healthcare System.
Good evening. I'm Alisa Curry. I'm your speaker for this evening. My official title is Dr. Alisa Curry. I'm a board-certified geriatric clinical specialist in physical therapy, and I'm going to be speaking with you tonight about diabetes and exercise. I've been working at Washington Hospital now for 26 years and have worked with patients with diabetes for almost my 30-year career, so I am definitely well-versed in patients with diabetes, and I'm happy to be presenting to you this evening. I'll go ahead and get started. So our goals this evening are to discuss the risk factors and effects of diabetes, which are always well covered by our inpatient and outpatient diabetes educators, as well as our nurses and dietitians. We want to discuss what actually clinicians mean when they say activity versus exercise. I think there's a lot of confusion about what is considered to be exercise, about different types of activity and exercise, which can include stretching, strengthening, and movement. We want to talk about ways that people can put these things to use tomorrow. So I want to give you some tools that you can use and change your level of participation. And then also, I want to identify resources for you to talk about how to maximize your function. The main things I want you to take away from this presentation tonight is that knowledge is not just power, it is control. And there's nothing that can make you feel more out of control than a condition like diabetes. There's a lot of medical conditions that patients just have no control. And you can feel sometimes like you've lost control over how your body reacts. But exercise is actually one of the best ways to regain some semblance of control, because it gives you back the ability to take care of yourself, to affect change within how you function through life with diabetes. Now, as many professionals will cover with you, there are several different risk factors that put patients at risk for diabetes. Once we reach the age of 45, that can be an increased risk, a family history, things like your lifestyle. Certain ethnic groups can be at a higher risk for diabetes, but it is the great equalizer that everyone is a potential risk for diabetes. Your triglyceride levels, HDL levels, medical conditions like metabolic syndrome, polycystic ovary syndrome, non-alcoholic fatty liver disease. There are certain skin conditions that can be risk factors for diabetes, hypertension, pregnancy. Even, people that work at night can be at risk because of dietary changes and issues, lack of activity, and especially other sleep disorders. So all of these factors can put patients at risk for diabetes. In the American Association of Clinical Endocrinologists algorithm, this was, I think, very helpful information. And I try to make sure that patients that I treat are aware of the factors that they want to try to gain a better handle on. So first is your A1C, your average blood sugars over a 3-month period. We'd like to see patients try to control their blood sugars at 6.5. Each person will decide with their physician what works the best for them. But the more that we can keep blood sugars at or around this level, it helps to decrease the tax to the human body. So controlling blood sugars, looking at your daily blood sugars, trying to keep them below 110, especially after you eat. We know that there's going to be a bump in blood sugar. So 2 hours post prandial glucose being 140 or less. We want to look at blood pressure, especially related to your physical makeup and your age, trying to keep systolic and diastolic blood pressures around 130 over 80, and then trying to look at reducing weight by 5 to 10%. The thing about weight loss in general is that we know that patients struggle with weight loss, and there's always sometimes a overwhelming sensation that it's impossible. When you talk about losing 10% of your body weight, if you weigh 300 pounds, that's 30 pounds. And weight does not come off overnight, but it's the small changes that affect the larger gains. It's like steering a boat. You never know that a tiny tweak at one point is going to take you the course that you want to go or the course that you don't want to go. So it's about making those little changes that eventually will have a larger impact. Now, some of the complications that can occur when blood sugars are not under control are effects on the overall body system. So we know that your vision can be impacted, and you can have issues around retinopathy or cataracts. We know that kidneys don't function as well, and patients can suffer from issues around renal failure, especially related to your feet. You can not only have issues around neuropathy, but you can also suffer changes to the structure of the foot. You can have breakdown of the joints in the foot, and especially because they are your weight-bearing surfaces, that can cause a lot of problems, even relating to things like balance and falls. Patients are at higher risk for stroke and heart disease, and obviously the vascular makeup. This is a lot of stress on the vascular system. Overall physical decline is really a compilation of multiple system deficits. And so it's important that we try to minimize the number of deficits that patients have. It is important to work with all of your healthcare professionals, but one of the most common professionals that I think people don't take as much advantage of is your local pharmacist. When you get your medications at your local pharmacy, your local pharmacists are one of the best free resources that you can have. So being able to walk into your local pharmacy and talk to the pharmacist and consult with them on the medications you take, the interactions, the side effects that they have, it's important for you as a patient to take control of that situation and to understand the effects. So make sure that you're utilizing your local pharmacy as a resource. Now, there's a lot of discussion around physical exercise, but let's talk about the effects of inactivity. Just sitting over time can create a lot of different problems that compound upon one another. We know that less activity can cause weight gain, especially if you're not burning off some of the things that we put in. It can increase your blood sugar levels. It can lead to increased circumferential weight around the waist, which can pull on the low back and the neck. That can cause pain. And as we talked about, there are systemic changes in how your heart functions and how your vessels function. So overall, these things are things that can compound your diabetes and make it worse. You hear from all sorts of healthcare professionals that exercise is good for you. But many times people don't know where to start, and it's okay to say, I don't know. That's why we are all here. As I always like to emphasize, healthcare is a team sport, and it's important that you know what you're dealing with, you know what makes up exercise and what constitutes exercise, because how we exercise is, and what we exercise and how we do it is important. Of course, we all remember when we were younger. We were, many of us were active as children. We were active as young adults. People, when they were in high school and college and, even recreationally could be very active. And so it's a very distressful situation when people remember how they used to be. As we get older, we get busy and we start to get involved with all sorts of things, family, friends, work, and those things tend to start to take precedent in our lives. So what can end up happening is that we then become less active, more involved in other things that take us away. And we know that when patients either are diagnosed as type 1 or type 2 diabetic, it is very possible that over time we become more inactive. And because of that, we find that we know what we need to do. We have to figure out a way to start being more involved, start initiating exercise when we know we used to do it before, but we've kind of forgotten. We know that we can't get back out on the basketball court, or we can't go out and walk 18 holes of golf, but we got to figure out where we can start to have a little impact and change. Over time, as the becoming sedentary increases, or the decrease in activity starts to compound, we forget more and more, and it can start to get overwhelming. And so what we're trying to do is we are trying to interrupt this cycle. This cycle, actually, it says aging continuum, but it really has nothing to do with age, because there are people out there who were active as young adults, or youngsters and young adults, but they get into middle age and they suffer with issues around diabetes. Many times there's a lot of excuses that people have also heard or have said themselves. I'm too old to start exercising. It's not safe because of my age. I don't have time to go to a gym. I don't have time or money to be involved in an exercise program. Too expensive. I'm afraid if I start doing something might happen. And so these are all fallacies in the grand scheme, because there are things that are free, there are things that are easy, and there are things that are fun that you can do for your physical activity. So the key thing that I want you to take from that is that everything you do is exercise. If you are moving, it is exercise. It's a matter of how much you move that is going to have the biggest impact for you. Now, one of the first things that people think about is walking. And many times there's the question of, how much should I walk per day? Well, according to the Mayo Clinic, they ask the question, do you have to do 10,000 steps a day? Because that's what many people read about. But no, the Mayo Clinic says that the average person walks about 3,000 to 4,000 steps a day. 3,000 steps is about 1.5 miles. 4,000 is about 2 miles. If you look at the chart on the right, this is looking at the impact to decreasing your mortality. So it says that if people walk more than 8,400 steps a day, women can decrease their mortality rate by 66%. If we jump down in the chart, if you walk more than 4,400 steps a day, which is a little above average, you're decreasing your mortality by 46%. The baseline in this particular chart discusses less than 2,700 steps a day, puts people just at that baseline amount. So even just figuring out a way to get 3,000 to 4,000 steps a day is a great way to have an impact on your quality of life. And if you don't know how many steps a day you walk, there's a lot of easy ways to measure that. You can do it with things like an Apple Watch or a Fitbit or the Garmin, but these are expensive. These may run anywhere from $50 up to $500. And not everybody has an extra $500 to spend on a watch. So there's other things that you can certainly buy and other things that you can certainly use that are absolutely free and available. If you want to talk about things that are less expensive than an Apple Watch or a Fitbit, there are items like the QB. This is a peddler device. This runs about, I would say, an average of $150 to $200. This is something that you can get through, online resources like everybody knows, Amazon or Costco. And this is a pedal elliptical. So for those people that are sedentary, this is a device that you can put somewhere in your home where it's not necessarily in your footpath, but maybe it's at one side of a couch or it's in front of a chair that's not used very often. And it can be used as a tool to get your heart rate up a little bit and to keep track of the number of revolutions you do. The pedometer that's listed here, this is extremely inexpensive. I think it's less than $30. And this is a device that's available for use for patients. It's so easy that you don't have to set it up. You can literally take it out of the package, take the tab off of it, and start using the device right away. It does have a battery in it that it says lasts up to 12 months. And this is something that is just a clip on or just put in your pocket, and it registers the steps that you take. The 4 types of activity that you want to think about incorporating into your life are cardiovascular exercise, things that get your heart rate up, strengthening exercises that challenge our physical muscle strength and our power, flexibility, which I think is one of the easiest and most important exercises that you can do because everybody can stand to be slightly more flexible. And flexibility actually helps to create more muscle available to make stronger or to challenge from a cardiovascular standpoint. And then the fourth type is balance and coordination. If you maintain your flexibility, it maintains everything else that you're able to do. So I think that at the bare minimum, it's important that you make sure that you challenge yourself in one of these types of activity. So let's look at some of the ways that we can challenge ourselves to do activity. You can do easy things like parking a little further away. You can dance. You can take a few more steps in your day. You can stretch. You can walk the dog. You might just want to go to a restaurant that you haven't been to before and try new foods, food is just as important a part of this as anything else. Even the amount of time that you stand in your home, increasing that time. So doing things around your home, around your house, cleaning the house is a form of exercise. So if you pick one space that you focus on and you work in that space for a period of time, that's more activity than maybe you'd be used to. Swimming, always a great activity. And things outside, anything that you do outside is going to challenge your balance because you're standing and walking on surfaces that are uneven. And of course, taking a few more stairs. We don't have to go crazy, but if you do 5 more stairs or 10 more stairs than you would have chosen to do at any other time, that's at least a win. Now we talk about stretching versus strengthening. So just so everybody is on the same page, understanding that strengthening and stretching are opposite. When we are strengthening or using a muscle, most of the time, that involves that muscle going from long to short. So if you think about picking up a can and bringing it up to your mouth, if you think about picking up a weight and doing a bicep curl, that is shortening the muscle. Stretching is elongation of the muscle. So it's important to understand that when you're working on getting stronger, that muscle is typically tightening up, shortening. And when you're stretching, then the muscle is lengthening. So both are important. If you're limited in your flexibility, it's important that you understand that to, as I said, create more muscle to use, stretching is a great place to start in your activity. Now, balance is a function of 3 different things. And balance is important in the grand scheme of things because when we have good balance, then we can function in the environment. So our balance is based on 3 things. It's based on how we get the input visually from our eyes, what we see. It's based on our vestibular system, which is our ears. And then it's also based on the proprioception, meaning what we feel. And all of those things are perceived by the brain. And then the brain sends a message back out to react to that. So if you think about standing on a boat, for example, when we can see the horizon, we can see the boat is moving, we can feel the change, the sway that comes with being on the boat, and we also feel the deck of the boat as we stand on it. So as the seas get rougher, then we start to see the horizon swaying side to side. We start to see the pitch of the boat up and down. So it's important for us to understand that if we closed our eyes, we would have to depend on just 2 systems. That means that we would have to then solely depend on the vestibular input of what we feel in our head as the boat pitches back and forth and what we're able to feel in our feet. Now, imagine that you have neuropathy in your feet and you can't feel and you close your eyes. You may only have your vestibular system. And as we age, sometimes our vestibular system can slow down. So when your visual input, your vestibular system, and your sensory system are all impacted, it's very common that these are things that can put people at a higher risk for falling because they're not getting that same feedback mechanism from their body that they would if all those systems were functioning correctly. So this is a visual representation. These are the different strategies. So typically, the first system that kicks in that can impact how we stand is our eyes. And the eyes can cause us just to make slight changes in how we push through our heels and our feet. So that's what we call in therapy an ankle strategy. So these are things where you might adjust how you move your feet by just adjusting for small changes. Now, when you can't make those ankle strategies, people tend to bend at the waist more. And that bending at the waist can cause people to have to do what's called a hip strategy, because that is making a bigger change. So what can happen is that you make bigger body changes to adjust. This can also happen if your vestibular system is not functioning as well, or if you're not able to get that input. And then if you have trouble with the ankles or the hips, it can cause you to have a wider base of support or take a step. And that can be what we call a stepping strategy. So when you see patients who struggle with balance and struggle with potential for fall, they can tend to have a wider base of support. They can tend to be a little more bent over. These are your patients who might use a walker to walk with, or patients who might have some limitations in their feet. I think overall, it's important for people to understand that it's critical overall that we address this with balance. One of the key things that I use in my practice, and I think I've changed as a therapist, and as I've said, when you've been practicing a long time as a physical therapist, sometimes, you have to really make sure that you do some basic assessments to make sure you're not missing anything. You never want to treat in a window. And one of the things that I've always looked at with patients is how much ankle flexibility patients have. When I see a patient that does have a wide base of support, or a patient who is having potential falls, one of the first things I look at is what this particular author pointed out in a study that looked at risk factors for older adults. The 4 factors that they pointed out are ankle flexibility, if people have bunions, if people had decreased sensation on their feet, and those patients who have conditions that can affect the big toe, conditions like gout, for example. What can happen is that any one of those 4 things can decrease how the foot hits the floor. And the more factors that someone has, the higher risk for falls they can be. So this particular study is an example of things that can impact diabetic patients, for example. They can have sensation problems. You can have issues around gout. You can have issues around bunions, especially for our older adults. And the less mobile patients are, the less ankle flexibility that you can have, which makes your body less reactionary. So this is something that, for a lot of people, it can limit how much they want to get up and move. And the less we move, the less energy we can burn, the higher the blood sugars can be. In general, 1 in 4 Americans over the age of 65 falls every year. Every 11 seconds, patients end up in the emergency room, and every 19 minutes, patients can die from the results from a fall. Falls are common, but we want to make sure that we decrease the chances of patients falling. Many of the factors that contribute to falls, there are factors that are not really as changeable, things like age, sometimes muscle weakness, we can't change that. Balance problems, we can have challenges with vision, low blood pressures due to medications, low blood pressures due to medical conditions, chronic neurologic conditions, arthritic conditions can make patients at higher risk for falling. And then there's external factors like the environment. When an environment is cluttered, when an environment does not have proper lighting, proper space, has obstacles or things that can make the environment unsafe, even if patients are taking medications that can put them at risk for secondary problems. And sometimes people who are not using the right assistive device, maybe it's time to switch over to a walker instead of using a cane, but people don't want to use a walker because they think it makes them look older. These are factors that we can address, but sometimes people are hesitant to address them. So we want to look at these factors because it all relates to mobility. So if you're having issues around falling, if you're having issues around unsteadiness, if you require more support, if you have trouble transitioning, so from even to uneven surfaces, on and off of the curb, if you have an urgency to urinate, incontinence is one of the big taboo subjects that people don't like to discuss, but I will share with you, as working in a hospital for this length of time, many patients have issues around urinary frequency and incontinence. And it's very common, very common. I would say that 50% of patients in the hospital can have issues around incontinence. And as we talked about, things like medications, all of these factors are things that you want to pay attention to, because these can be minor factors that are treatable in some way, shape, or form, but can decrease your activity. Some of the tests that we use to assess balance and gait, we look at things like the time frame that it takes for somebody to perform 5 sit to stands from a chair. The things like balance and gait, we have standardized testing for that. We have standardized tests for the time that it takes someone to stand up from a chair, walk 10 feet away, turn around, come back and sit down. We also have standardized testing around 30 seconds, how many times someone can sit to stand from a chair. Activities like this, which have standardized tests, can also double as the activities that someone can do just to start to increase activity in their day-to-day lives. So a 5-time sit to stand, someone can perform that as their exercise. Someone can perform a timed up and go, so they can get up, they can walk 10 feet across the room, come back and sit down. And those types of activities are increasing the activity that someone does in their day-to-day life. If you're more physically capable, then certainly there's other things that you can do. As this study points out, looking at diabetes and impaired function, a structured but flexible exercise program is an effective tool to improve someone's physical function. So it's important for people to do what they can tolerate doing. If you want to increase your cardiovascular health, you can do things like walking or dancing or cycling or walking that 9 holes of golf instead of 18, or maybe, you go drive to the local mall and walk around. One of the easiest things to do is go to the grocery store and walk in the grocery store and work on increasing your endurance, because those types of things challenge you. You don't have to buy anything. You can just walk through the aisles at the grocery store. And the great part is, if you're unsteady in your balance, you can use a cart, and that helps to give you something to steady yourself. Things to increase your muscle strength and power, obviously lifting anything that's going to challenge your physical function. So that can be going to the gym, that can be resistive bands, that can be big cans of beans, it can be a gallon of milk. A gallon of milk, just for the record, weighs 8.8 pounds. And so even taking an empty gallon container, filling it up with water, and making sure that you tape it shut, and that becomes your weight that you use to lift and move and curl and swing. And that's something that you can do. And then your own body weight. There is so much benefit to body weight exercises. And I think that is very valuable for patients to do. So even, like I said, doing something like sitting in a chair with nice and sturdy arms, it can be an indoor or outdoor chair. You can use that for your body weight. And that can help you stand up or help you sit down. But it also helps to exercise the arms. Flexibility. Learning how to stretch. The rule of thumb on stretching is that if you're feeling a stretching sensation or a pulling sensation in the area you're trying to, you're doing your exercise correctly. So organized classes like yoga and Pilates or videos can be helpful. You can also just do an at-home stretching program. There's some great books and videos on things like that I'll talk about in a few minutes. Balance and coordination exercises. There are some fantastic apps that are in the app store of your phone or your tablet. So there are things that you can download, and that can make a big difference in increasing your balance and coordination. It's about decreasing that base of support. So going from a wide stance and then narrowing that stance down, and then eventually being able to stagger your feet to the point of almost being able to stand heel to toe. You may not get to that point. You may be able to do that today. The key is you find where you start, and then you work on improving. And then the other exercise that I think is critical to include in this 4-part of exercises is what you eat, because you need to supply your body with energy, but you also need to be able to burn it off. So we know that patients who exercise and have diabetes, it can drop your blood sugar. So it's always a good idea to eat about an hour to 3 hours before you exercise. It's important to monitor your blood sugar, especially when you're starting an exercise program. And this isn't really talked about, but you're going to burn off certain calories. And depending on how aggressive you are with your exercise, you want to get a baseline of how your body reacts. So monitoring your blood sugars when you start an exercise program is key. You also want to look at the food categories that you're eating. We talk about carbs and we talk about, sugars, simple sugars, complex sugars. We talk about fats, good proteins. Protein is always a helpful thing because proteins feed the body. So learning what the proteins are and then focusing on those proteins. Carbs are delicious and they can provide you with quick energy, but protein actually is the energy that you want to use. Look at the volume of food that you eat. That's another thing. Volume is key because if you're like me, I like to eat. Food is delicious. That's why we have it. So looking at the volume of food that we eat during our day, that's also critical. Sometimes we don't need to eat as much. Sometimes we're afraid we're not going to get it. So we eat more because we don't know when we're going to have that next that next chance at delicious food. But the reality is you're always going to have that chance to eat something. So let's make the choices good, but let's also, if you're going to eat something, let's watch the volume of what we eat and then plan for a little bit more the next time. Hydration is key. Hydration is important. Many times, a good glass of ice water tastes delicious. I am not a water drinker, but I did find that I like ice cold water versus tap water. Some people are opposite. They love tap water, hate ice water. Some people don't like water, but there's some hydration strategies that you can use. And that's where our dietitians can really work with you to figure out what you like and don't like, figuring out what things you can drink, figuring out what ways to trick yourself. I have a affinity for the double-walled 18-8 stainless steel containers because I have ice water that I can, keep cold all day long, whether it's in my car or at my desk. And that's the way that I get myself to drink more. And then learning how to cook a meal, learning how to cook a dish, learning how to make your own food. That's a great way to not only burn energy, but to enjoy the benefits. So I think food as a category in exercise is just as important as lifting weights, as stretching, as doing all the other things. The other thing that's a great exercise, let's talk about some things that you can do around your house that don't cost anything. One of the best things that I think anybody can do for themselves is to practice getting up and down from the floor. Getting up and down from the floor is an essential exercise because many people get afraid about what happens if they fall. And I have this discussion a lot with people. But the thing is, the more that we decrease that fear of falling and the more that we take control, the better off we're going to be and the better off that we're going to react in the event that we do have a fall. So I think controlled going down to the floor and getting up from the floor is key in the process of your own health and your own safety. To get up and down from the floor, you also have to make sure that you have that flexibility. You have to be able to bend your knees, as you can see the person's doing in the upper left here. They've got to be able to get those knees bent to 90 and 90 degrees. If putting your legs down to the floor, kneeling on your knee is not comfortable, you can always put couch cushions down to start with, double up pillows. You don't have to get all the way down, all the way up, unless you know that you've got that flexibility. Getting down next to a chair or something stable like a couch is always helpful as well. And you start with practicing next to something, and then you can transition to practicing maybe in an open area. You always want to start something like this. If you know you're already struggling with just walking, I wouldn't recommend trying to get up and down from the floor by yourself. I would recommend doing it in steps, doing it with people nearby, and also even, working with a therapist or working with a caregiver so that they're there to help you start the process of training for something like this. But this exercise alone challenges your flexibility, challenges your strength, and challenges your balance, because you've got to be able to have all of those to get up and down. Other things that are free. There are some really great sites available for absolutely free. I endorse this person because I think that he provides a fantastic service. This is a gentleman named Justin Augustin. He's a personal trainer out of Canada. He's on Instagram. And one of the things I love about his work is that he does some very basic exercise programs and videos. He has a site on Instagram where he creates short little snippet videos that are all of 30 seconds to a minute long. And he teaches things like how to stretch, how to start exercise, how to start paying attention to your heart rate. And I think that this is important for people out there who are afraid to start exercising. His fiance is also doing the more challenging. And I think that, for a lot of people, you're past the point of doing the basic exercise. You need to challenge yourself, and you want to challenge yourself. So the great part about these things is that you don't have to be the best and you aren't the worst. You're just going to start where you start, and you're going to continue to get better from where you are. So things like this, if you don't know how to access it, I guarantee you, if you have someone in your life under the age of 35 or even 25, they will know how to access this. So this is a great thing to set up with younger family members to teach you how to access these things and to make them available to you. Because if you can be on this call tonight, on this Zoom, then you can access any one of these things as well. At Washington Hospital, our outpatient neurophysical therapy department is available by referral. Patients can come in, they can make an appointment with a referral from their physician, or we have the orthopedic physical therapy clinic, which is at our Civic Center building at the corner of Civic and Walnut in Fremont. Either one of these, especially for our patients who are more physically challenged, the main hospital outpatient neuro PT department is exactly what we're there for. We want to help people become better at balance and safety. We want our higher functioning patients to get direction about how to exercise. And this is exactly the type of thing that you can do with just a few visits with a therapist. There's classes that are available in the community. At our 2500 building, we have yoga classes that people can attend. We have massage therapists that people can access, just community people that can access, massage from our massage therapists there. There's all of the standard opportunities to exercise. Many local gyms will have a trainer. And when you sign up, there's people that can direct you on how to exercise. Again, you don't have to start out by being overly aggressive. If you want to go to the gym for 15 minutes and do 2 machines, and you're only on those machines for 7.5 minutes each, that's okay. There's nothing wrong with that. But people think they have to go to the gym and be in the gym for an hour, and they have to do all these different machines and a full circuit. And the reality is, if you go to the gym and you do as much as you want and you leave when you're ready, that's more than if you didn't go at all. So that's really the important thing I try to emphasize. As I talked about, there are apps and games and websites that you can access that make all of this very accessible for little to no cost at all. So there's so many things that we can do in our community to be more active and to improve our physical health. Even in your home, if you don't leave your house, look at what you have in your home. Do you have a walking path around your home, either indoors or outdoors, that you can do safely? People who have a kitchen, you can walk from one side of the kitchen to the other. So if I start to the right of the sink and I'm challenged for balance, I can just surf right along the sink, and I can come around the counter, and I can walk past the stove, and I can come around all the way to this counter, and then I can walk back all the way around and back around to the end of the counter. You may even want to have a chair at either end. If that's too challenging and someone's not safe, standing with one hand on the counter and one hand on the island, you can practice standing between those two surfaces. Gives you something solid to hold on to. I love when I do home health patients, I love having a patient stand at the sink or the countertop in the corner, because it actually gives you a nice solid surface to lean on. And so taking advantage of things like this help to improve your function and your mobility within your home. It's really about recognizing the opportunities that are available. And sometimes if you look at it, with someone that can help, it can help you to develop something that you can do. This is outside my own home. And so when I bought my house, I looked at my house to see where could I exercise if I wanted to exercise. Well, I could get up and down from this planter. I can sit on this planter, which is about 14 to 16 inches high, and stand up and down off that. I have a step here that I can do step ups and step downs with. If you notice the grass here, the grass is a great uneven surface to practice getting up and down on, or to walking across with someone if I was challenged in my balance. And then, of course, just walks along the sidewalk. You can see that across the street, there's even a business and a parking lot where if I just needed more open space to walk, that space could be utilized. And same thing in the backyard, having chairs available for people with endurance issues, having being able to walk back and forth across the patio, sitting up and down from the surface here, which is about 18 inches high. It's really about just looking at your own environment and creating some opportunities for yourself just to be more active. The more that you think about, I just want to increase the amount of time that I'm moving per day. That's all that you have to do to just get a program started. So my final points that I just want to make sure that people understand: you want to be proactive and take control in your healthcare. You don't want to be reactive. The time to decide that you're ready to do something is not when you're being discharged from the hospital. The time to decide that you're ready to do something is today. And it doesn't cost anything to start exercising. It costs a lot less to start an exercise program than it does to be sedentary, because when you're sedentary, you're creating compounding problems that can get worse. Just remember that devices keep you independent. So if you're worried about how you look with a cane, don't worry about it. If you transition to a walker gives you that much more support. It can allow you to have a little more endurance, and it can allow you to go farther. I also emphasize that if you like to eat, you have to move, because you want to be able to burn off the calories that you put in. So make sure that you take control of that situation by choosing things that you like, figuring out ways to make them available to yourself, and then figuring out ways to burn those calories off, because honestly, that is something that you can have control over. So take advantage of those points and take control over how much you move. The points that we want to emphasize about activity, and this was emphasized again by the comprehensive care plan through endocrinologists in the American College of Endocrinology, they encourage a brisk walk, and a brisk walk doesn't mean necessarily fast, it means challenging. So if it challenges you to walk slowly, that's okay, that's a challenge. But you try to get in multiple minutes a week. 150 minutes a week are recommended. So on a 5-day week, that's a 30-minute walk, but you can split it up to 7 days and do a little less, or you can walk a little longer. It may take you a half an hour to walk 5 houses away and 5 houses back. But if you do it, that's more activity than you've done. We talked about flexibility and strengthening. We've talked about making sure that you discuss with your physicians how much you're exercising. We talk about type 1 diabetics and type 2 diabetics needing to monitor their blood sugar activity, and especially knowing how your body reacts after you exercise is important. Those are the factors that you want to pay attention to, making sure that you're not dropping your blood sugars with exercise. So that is key to starting a program. But the main thing is start with just one thing. Start with more water, start with one push-up, start with walking one more house away, one more shop away. It's really about starting those things today and then repeating it tomorrow. So I'd like to thank you for attending. My email is at the bottom of this video. It's Alisa_Curry. So it's ALISA_CURRY at WHHS.com. Thank you very much. And I'm glad I was able to share this with you. Have a great day. Bye-bye.